Joe Agustinelli, Social Media Manager for Greenway Health, and thank you for tuning into this episode of our podcast, Putting Possibility into Practice. On this episode, I am joined by Greenway Health CEO Scott Zimmerman. Scott and I will discuss the Project Polaris Customer Advisory Board, which earlier in May held its first meeting. I'll also talk with Gus Taylor of Florida Medical Clinic, who is one of 19 members on the Customer Advisory Board. Plus, we'll look at how the development of Greenway Health's next-generation EHR and practice management platform will help with providers who are dealing with physician burnout. New statistics show that more than half of practicing physicians show signs of burnout. Scott, welcome once again to our podcast. And you were in attendance at that Customer Advisory Board meeting. It was, as I mentioned, the first time the board had come together. What did you take away from that meeting as Greenway develops its next generation EHR and practice management solution with customer engagement?
You know what I get most excited about, number one, is the relationships. You know, for me and for some members of the team, it's an opportunity for all of us to get to know each other. And I think there's a real learning that we're going to have as an organization as these customers come together. But I also think there's real value in them coming from different environments, having different specialties that they're focused on. There's a real opportunity for everybody to kind of learn together. As we create a system that's built by caregivers for caregivers. And maybe the greatest gift in the room is all the diversity that really exists, and watching people around the table on different systems really raising up different viewpoints so that we can really struggle and wade through those viewpoints as we try to build a more effective system that really works as an extension of the way caregivers work and really supports caregivers for amplifying intelligence at the point of the care. So that emotion, that engagement, the excitement, and really as we talked about some of the things that we were planning to do, listen to customers like audible noises of excitement about what it would mean if we were to make changes that we're intending to make. So that was what was most exciting for me.
And as I mentioned, we're also joined by Gus Taylor with Florida Medical Clinic, a large practice that covers Hillsborough and Pasco counties in the state of Florida. And I welcome him to discuss our Customer Advisory Board and what his takeaways were from their inaugural meeting. So let's talk about Florida Medical Clinic. 350 providers, 30 distinct fields, a big practice. Tell us a little bit more about the organization, locations, and specialties.
Sure. So Florida Medical Clinic was founded in 1993, so we're coming up on our 25th anniversary. It was founded by 4 providers, 2 primary, 2 specialty in Zephyr Hills, Florida. We have since grown from that to over 350 providers, 50 different locations in the Hillsborough and Pasco County areas. We have been on Entergy and Entergy EHR since 2006. They have been very good products for us and for our practice. We see almost 5,000 patients every single day, and we also manage different ancillary departments, pharmacies, surgery centers, physical therapies, lab, and we run all of that through the Entergy product.
And we just mentioned Entergy, which you joined got on in 2006. And how do you feel about your current EHR solution from Greenway Health?
It works well for us. It's very flexible. And again, with that many specialties, it needs to be flexible. We've used it for a long time, so we've learned how to customize it to do what we need.
As I mentioned in the introduction, you are one of the members of the Project Polaris Customer Advisory Board. Why did you choose to join the Customer Advisory Board?
So I believe that us being a multi-specialty clinic in the Tampa area and a longtime Greenway customer, we have a unique ability to work closely with Greenway on this project. Our providers and our revenue cycle team are local and available to come to Tampa to meet with or work with the Greenway team. We've also had the Greenway team come to our practice and observe how our providers work. Watch our workflows, ask us questions, and really given our unique background as people who've worked on the medical manager product and the Entergy EHR products and Greenway community, we can have a different view, I think, on some of these items. Also being an enterprise level customer, we have a different view maybe than some of the 20 provider practices. And again, we're an ACO. And there are a lot of, I'll say, government-type regulations and things that we're trying to solve as we move out of the fee-for-service into the value world. And we feel that the partnership with Greenway is critical for our future, so we want to be involved with them.
And what are you looking forward to the most in serving on the customer advisory board?
Really making sure that this product is the best that it can be for our providers and for our patients. I think the current product is good, but it does fall short in some areas as time has evolved with any EMR. And it's, again, a very unique opportunity to sort of start from scratch and take the best of what's there today and fix the areas that might need some improvement.
And what challenges can Greenway Health, through Project Polaris, help Florida Medical Clinic resolve?
I think the number one challenge is really streamline data entry into the EHR, make it much easier for the provider to get data into the system so that they can actually spend more time with the patient and focusing on the patient instead of on the software. I think it's also important to position us for the future as healthcare changes, that the Polaris product is flexible enough to help us through those transitions.
And I thank you for your time again today. Gus, some great information in regards to the Customer Advisory Board for Project Polaris. That was Gus Taylor of Florida Medical Clinic, the Chief Administrative Officer, as we mentioned, Florida Medical Clinic, with more than 350 providers, 30 distinct fields and locations throughout Hillsborough and Pasco counties in Florida. Reminder, you can follow Florida Medical Clinic on Twitter at FLMed, M-E-D, Clinic, C-L-I-N-I-C. You can also find them on Facebook at Florida Medical Clinic, or visit them on the web at www.floridamedicalclinic.com. And as Gus mentioned, one of the tones of the Customer Advisory Board and one of the concerns that was raised is designing this next solution with the caregiver in mind, dealing with physician burnout. What are you hearing from customers regarding physician burnout?
I think we see this as a very real issue, that's beginning to get the airtime that it deserves to get. We had a session at the Customer Advisory Board, and I would say it was one of the most passionate sessions that was discussed. And when we really think about what's going on for folks, they've got this technology that they're using, but in the end, the expectation on them is completely changing. We're asking physicians have about quadruple the amount of documentation that they're needing to do inside of these charts. Really, they feel like nothing's going away. We're only adding new things to their plate. They're being expected to take on some of the coding burden. There's also a lot of defensive noting and things like that going on. They're not really getting credit for all the work they're doing with the patients in the exam room. And then, of course, there's the learning burden that they have as well. So there's a lot more that's expected of them. It creates a lot of cognitive overload for them. And of course, the concern is not only the compassion for what they're going through. I really think we're disrespecting how important their role is in the health system, but there's a propensity for more mistakes if we're really not tending to this burden and really helping physicians to get off the treadmill. So I'm really excited as an organization about what we can do, not only with systems and through things like Project Polaris, but what we can do as an organization to support and help relieve some of that burden.
And according to a recent study, more than half of physicians meet the criteria for physician burnout, as we've seen that EHR use and administrative burden are being blamed for accelerating the onset of burnout. There was also a recent article in the New York Times discussing physician burnout and how technology relates to that. In regards to Project Polaris, how can Greenway help offset physician burnout with its product solutions?
I think the system level is just one perspective of what's getting in the way, but it's a really important perspective. And what I've really been advocating for inside of Greenway and where we're really making investments is about having a deeper understanding of the work itself, not just for the physician, but for everybody inside in the caregiver team. And that means we need to understand what it's like to work in their environment. We need to surface their spoken as well as their unspoken needs. What are the roles that use the system? What are the jobs that those roles do? What are the outcomes they're trying to create? And we really need to be striving to simplify the complexity that can exist inside these systems. We need to imagine new ways of working for the caregivers. we need to make systems that really operate as a seamless extension of the way the customers work while trying to amplify intelligence at the point of the care, so we can do a greater job creating physician and patient safety, but also that we can support better physician outcomes. And I think if we can really help physicians transcend the time they spend on documentation, we can really help them get back to focusing on changing patients' lives, which is the reason they fell in love with medicine in the first place.
And, currently, how can Greenway Health play a role in reducing the burden on practices and care providers? We've heard and we've read case studies, and you can read some of our latest case studies on our website at www.greenwayhealth.com on how providers have partnered with Greenway Health. But, some of the teams that are in place here in Greenway, how can they contribute to helping reduce the burden that's on physicians and caregivers?
I certainly think, part of that is making it easier to do, business with Greenway. So we talk about the system piece of what we can do. Another piece of what's really important to us is how do we go beyond the software and service we sell to really support customers for being successful? How do we support them for having practices that don't just survive, but thrive in an environment that's rapidly changing? And so one of the pieces that's so important to us from a mission perspective is really how do we support practices and inspire practices to transform, which is really about how do we get them into a mindset that's allowing them to not just react to the changes that are happening, whether they be the regulatory changes or the transformation of a patient to a healthcare consumer who has more demands on their office. And I think if we can better support them through information that we have, resources that we have, putting them in touch with best practices that some of the other customers in our community are doing, we can better help them adapt to that change and really realize their full potential as an individual and as a practice. And I think there are lots of opportunities. I think that the change isn't just with these systems and the regulations. It's really about how can we support these practices for better collaboration, because we need to be able to coordinate care, often outside of the brick and mortar we may be operating in today. Communication practices with other people on the care team, but also with the patient, need to continue to kind of mature in order to realize their full potential. And I think there's a lot of structural things we can do to support them along the journey. And so what we see is an environment that's filled with a lot of rapid and continuous change. And I think that the perspective that we need to have is that these physicians and these practices are on a development continuum. There's an imperative for them to kind of continue to develop and meet that challenge and have the resilience to meet that challenge. And I think some of these other programs that we're putting together really do a good job of helping to bring out their best work.
And I thank Scott Zimmerman, the CEO of Greenway Health, for being a guest on our podcast today. Now, for more information on physician burnout and dealing with physician burnout, I do invite you to visit our website and visit the Knowledge Center on our website. Scott recently had a blog entry on physician burnout, which goes into great detail about some of the solutions and physicians dealing with burnout and how Greenway can help reduce that burden and the ongoing healthcare industry trend of burnout. We also have webinars on our YouTube channel that have discussed physician burnout and additional blog entries in the Greenway Health Knowledge Center. You can find all that at www.greenwayhealth.com/Knowledge Center. I also invite you to follow Scott on Twitter and on LinkedIn. You can follow him on Twitter handle Scott Z Says. That's SCOTTZ SAYS. And you can also follow his LinkedIn profile. Once again, I thank my guests, CEO Scott Zimmerman and Gus Taylor of Florida Medical Clinic, for their insight into the Customer Advisory Board on Project Polaris and on physician burnout. I'm Joe Augustinelli, Social Media Manager at Greenway Health. I thank you for listening to our podcast, and I invite you to subscribe to our podcast on SoundCloud, at the Apple iTunes Store, or on Google Play Music.